Pilocarpine, Timoptic, Atropine, Neosynephrine, and Diamox. If you don't know what those eye drops are for, you might want to watch this video coming right up after this. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the very best NCLEX review in the entire universe, in my opinion. We offer various services, including we have a streaming service where you can get all of our videos with no commercials. It does cost $19.99 a month, but it's worth it. Go to clinicreviews.com to find out more about our streaming service if you're interested in that. Today, we are going to continue our walk through the Blue Book. We're on pages 109 and 110 of the Blue Book. The Blue Book is right back there, standing right there behind me on top of my fireplace. You can get it on Amazon.com. And if you're outside the United States, you can download it as a Blue Book app. Go to clinicreviews.com to get the Blue Book app. So I am first, because this is a little bit busy and confusing, I want to just do a table. I'm a table person, y'all. Some people like acronyms and other things to remember. I do really well with a table. So what I want to do is I want to just talk about the 3 classes of drugs that are used that we're talking about here. 2 of them are for glaucoma. One of them is a dilator. So you don't want to dilate the pupils of a patient with glaucoma. If you dilate the pupils, you can actually increase intraocular pressure, and that's bad. But the other 2 drugs are used for glaucoma. So let's talk about it. So first we have the carbonic anhydrase inhibitors and the miotics. But let's first talk about the carbonic anhydrase inhibitors. An example, I'm just going to go down to the exemplar, is Diamox. These are eye drops, y'all. These primarily don't have strong systemic effects. They can have some systemic effects, but they're fairly limited. Most of the symptoms are going to be associated with the eyes. So the indication for carbonic anhydrase inhibitors is glaucoma. So Diamox is used to treat glaucoma. The action is it decreases the aqueous humor production, which decreases the intraocular pressure. So glaucoma is all about pressure. You want to decrease the pressure. So by decreasing the intraocular humor, you can decrease the pressure. And it does cause one systemic effect, which is diuresis. Okay, so that can affect. Now, miotics vasoconstrict. Interestingly enough, vasoconstriction is an appropriate treatment for glaucoma. If the Diamox, the carbonic anhydrase inhibitor, doesn't work, we can go to a miotic. That's a vasoconstrictor. And mydriatic, in the middle column there, it says anticholinergic or mydriatic, the D in mydriatic. Think that D stands for dilation. Mydriatic is pupillary dilation. So miotic is constriction. So it is used sort of a secondary treatment for glaucoma. It does constrict the pupils. If it gets on the skin around the eyes, it can cause contact dermatitis. So you do want to make sure that you use a tissue and wipe it away after you give it. And examples of these miotics are Timoptic or pilocarpine, or any drug that ends in LOL. All right, so carbonic anhydrase inhibitors, Diamox, and miotics, Timoptic and pilocarpine, are used for treating glaucoma. The one decreases intraocular pressure. The other one causes vasoconstriction. Diamox can cause diuresis. So think Diamox goes with diuresis. The miotic can cause contact dermatitis if it gets onto the skin. Now, the other type of eye drop that you can get tested on are anticholinergics. Now, remember, anticholinergic is acetylcholine is the neurotransmitter for the parasympathetic nervous system. The parasympathetic nervous system causes constriction, but if you give an anticholinergic, you cause dilation. So anticholinergics cause dilation, and direct mydriatics also cause dilation. Okay, so why would we want to dilate the eye? Well, we want to dilate the eye if we want to be able to see to the back of the eye. And so what happens is examples of, well, an anticholinergic or a mydriatic are atropine, cyclogel, or neosynephrine. So these are 3 exemplar drugs. They're given for like surgery, pre-op surgery, if you want to dilate the eye and you want to be able to see back there. So pre-op cataract surgery or an eye exam. You have ever been to the eye doctor where they've dilated your eyes so they can see and the lights seem extremely bright, right? Now you've got tears running down your eyes because they're shining this light in your eye and you're like, oh, I want to close my eyes. It's so bright. And then what happens when you leave? When they dilate your eyes and you leave, what happens? You have photophobia. So you're sensitive to light. That's one of the side effects. It's not an adverse effect. It's uncomfortable, but you don't not give the med because of photophobia. It can also cause tachycardia because it is an anticholinergic. And it does cause cycloplegia. Cycloplegia is paralysis of the pupil. So the pupil will dilate and it cannot constrict. It cannot constrict no matter how bright the light is. So that's cycloplegia, okay? And the anticholinergics, mydriatics, are absolutely contraindicated in glaucoma because dilation increases intraocular pressure, all right? So let's go ahead and get into our questions now. Question number 1, a nurse is providing education to a patient prescribed Diamox. What is Diamox? Diamox is used for glaucoma and it decreases intraocular pressure and causes diuresis. All right, so now I know what Diamox is for the treatment of glaucoma. Which statement by the patient indicates the need for further teaching? So I'm looking for the false statement. This medication will help decrease the pressure in my eyes. Well, that's a true statement. We're looking for further teaching. We're looking for false. I should take this medication on an empty stomach to improve absorption. Y'all, it's an eye drop. It doesn't matter if you have any food in your stomach. C, I need to report any unusual tingling in my hands or feet to my healthcare provider. Well, that's true no matter what med it is. Like, it doesn't matter what you got going on. I would report any unusual tingling to my healthcare provider. So that's a true statement. D, I should drink plenty of fluids to prevent kidney stones. Well, you certainly should drink plenty of fluids to prevent kidney stones. That's a true statement. Just in general, that's a true statement. C is a true statement. A is a true statement. B is a false statement. So let's reread the question or the last sentence. Which statement by the patient indicates a need for further teaching? I'm looking for the false statement. So the answer I'm choosing is B because that's the only false statement here. 2, a patient with a history of congestive heart failure is prescribed a carbonic anhydrase inhibitor. Which electrolyte imbalance should the nurse monitor for while the patient is on this medication? Hyperkalemia, hypocalcemia, hypernatremia, hypokalemia. Well, it can cause diuresis, right? A carbonic anhydrase inhibitor causes diuresis. And when you have diuresis, you can watch for hypokalemia. So what I don't want you to do is go, well, I thought you said it didn't have any systemic effect. How do I know it's a potassium wasting diuretic? Okay, don't ask all those questions. The only one, I mean, you can look them up and ask, you can ask all those questions if you want to, but look, one of the most frustrating things you're going to find is when you're studying for the NCLEX is if you have to know the answer to every question while you're getting ready. What you have to be able to do is get most of the questions right. And you have to have strategies for getting them right. The NCLEX is not testing, do you know everything about everything? It's asking, do you have common sense and good clinical reasoning? And good clinical reasoning would say, well, a carbonic anhydrase inhibitor can cause diuresis. And I know it is common with diuresis to lose potassium. And so the only answer that makes any sense here is hypokalemia. If you're an overthinker, and many of you are overthinkers, overthinking is one of the big reasons people fail. NCLEX is overthinking. You need to really work on that. When you're taking the NCLEX is not the time to overthink. Look, if you're an overthinker, fine. Overthink all you want to, but don't overthink while you're taking the NCLEX. 3, which of the following patients should avoid the use of atropine eye drops? I'll say, okay, atropine eye drop is an anticholinergic. It causes mydriasis, which is dilation. So now I know what atropine does. A patient with chronic angle glaucoma. Well, I know dilation is absolutely contraindicated with glaucoma. So it seems like someone with glaucoma should avoid atropine eye drops. Patient with a history of allergic conjunctivitis. I don't see any reason why that would be a problem. It's a history of allergic conjunctivitis. They don't have it now. A patient with cataracts. I don't see any reason why. A patient with benign hepatic prostatic hyperplasia. Good grief, I can't even say it. No, I mean, maybe, right? But I know for sure that atropine is absolutely contraindicated in glaucoma. So don't overthink it. You pick the answer you know, not the answer you're not sure about. 4, a nurse is teaching a patient about the use of anticholinergic eye drops for an upcoming eye examination. So I know we give anticholinergic eye drops because it's a mydriatic. I know we give that to cause pupillary dilation. Which of the following statements by the patient indicates a correct understanding of the medication? A, these drops will help reduce the pressure in my eyes. No, that's not true. The drops will constrict my pupils to improve vision. No, that's not true. They cause dilation. These drops will temporarily paralyze my ciliary muscles to dilate my pupils. Yes, that's exactly what it does. I need to use these drops daily to maintain eye health. No, that's not true. So the only correct answer is C. 5, a patient is prescribed anticholinergic eye drops for the treatment of uveitis. Which of the following side effects should the nurse include in the teaching plan? So I don't know what uveitis is. Let's say I don't know what uveitis is. I could probably figure it out if I know my prefixes and my suffixes, because itis is an inflammation, but nevertheless. So they're giving this anticholinergic eye drop. It must be an eye problem. If they're giving an eye drop, it must be an eye problem. But one of the testing strategies that I want you to remember is if you don't know what something is, turn it into another word that you do know it is. So I know itis is inflammation. So there's some kind of inflammation in the eye. Okay. And I can know that if you did the suffixes videos, then you know itis is an inflammation. So some kind of inflammation in the eye. Which of the following side effects should the nurse include in the teaching plan? Well, I know anticholinergics are mydriatics. They cause mydriasis, which is dilation. Whether I'm giving it before an eye exam or I'm giving it for something else, it's still going to cause the same things. So it causes dilation, which causes blurred vision. So I know A is true. I know that's a side effect. Increased tear production. No reason to think that. No reason to think that. Improved near vision. No, it doesn't do anything for vision. In fact, it causes blurred vision. Reduced sensitivity to light. Well, no, actually, if they're going to dilate, they're going to have increased sensitivity to light. So blurred vision is the one that I know to be true. 6, a nurse is explaining the purpose of Temoptic eye drops to a patient diagnosed with glaucoma. Which statement by the nurse is correct? So what do we know about Temoptic? Temoptic is a miotic. So miotics constrict, pupillary constriction. That's what Temoptic does. Okay, so they're the purpose of it for someone with glaucoma. All right, so which statement is correct? Miotic eye drops dilate the pupils. No, that's not true. These drops will constrict your pupils. That's true, helping to decrease the pressure in your eyes. Well, that's true. Miotic eye drops are used to reduce inflammation in the eyes. That's not true. These drops will help reduce the production of tears, in your eyes. Actually, that's not true. Well, I mean, it's not true, but let's just say you're like, I don't know if that's true or not. What one do you know for sure is true? You know, Temoptic, because it is a miotic, you know it's going to constrict the pupils. So pick the answer you know, not the answer you don't know. And if you're an overthinker, you're going to go, well, now I got to figure out what it does to tear production. Okay, I'm going to look it up and I'm going to figure out what Temoptic does to tear production. You don't need to know what Temoptic does to tear production, y'all. If you end up working in an eye clinic and you want to look and see what Temoptic does to tear production, you can look it up. I don't know what it does to tear production. I could make some educated guesses about what it does to tear production, which is probably, my guess would be it does nothing to tear production. Nevertheless, I don't need to know that for the NCLEX. Okay, I'm getting all worked up. I'm going to chill out. My daughter would go, Mother, calm down. So I'm going to calm down. A patient with glaucoma is prescribed pilocarpine eye drops. Pilocarpine is a miotic, which causes constriction. Which of the following instructions should the nurse include in the patient teaching? Apply the drops directly to the cornea to ensure proper absorption. No, the correct application is the inner eye. And it's from the inner canthus to the outer canthus. So that's how the proper administration. Avoid blinking for at least 1 minute after administering the eye drops. Well, you can't completely avoid blinking. Use the drops in the evening before going to bed. I don't know if that's true. Report any increased salivation or sweating to your healthcare provider. Well, any change in assessment, I would tell them, if I don't think it's a side effect, I'm going to tell them to report it to the doctor. So I know, let's see, which of the following instructions should the nurse include? So I'm looking for the true statement. So I know A is false. B doesn't seem reasonable to me. If I just use my common sense, and I never throw my common sense out the window, B doesn't make any sense. C, I don't know why it would matter when we use the eye drops. But D is saying report any unexpected symptoms. And that seems like a good idea to report any unexpected symptoms. So I'm picking D. 8, a patient using miotic eye drops, miotics or miosis is constriction. For glaucoma, reports difficulty seeing in dim light, which is the most appropriate response by the nurse. This is an expected side effect. Try to use brighter lighting in your home. Well, if you pupillary constrict, I would think that you would need brighter light to be able to see, because your eye's not letting you take in as much light. So A makes sense to me. B, you should stop using the eye drops immediately. No. C, this indicates the drops are not working correctly. You need a higher dose. That doesn't make any sense. It's unusual to have vision changes with these drops. You may need an eye exam. Well, anytime you're giving somebody eye drops, I would think there could be some vision changes. And particularly because I know it causes pupillary constriction, and I know the eye's gonna be taking in less light. I go, well, yeah, it's like you're gonna need brighter light. That makes sense to me. So remember what I said. Do not throw your common sense out the window. These were not particularly difficult questions, but if you don't know what you need to know, they're going to become much more difficult. Remember, the blue book is all about knowledge. So I'm going to point to it over my shoulder again. It's right there. I hope you have a great rest of your day and good luck on your NCLEX, y'all.